Hi everyone, I'm Dr. Deepu from the Hyderabad Gynecomastia Center, and today I'm going to talk about a few points regarding gynecomastia. Now, gynecomastia is an extremely common condition that we're seeing nowadays, and it's nothing but development of breast tissue in men. So normally, if you take the normal developmental pattern, both men and women have what is known as a breast bud. So this breast bud generally during puberty, because of the estrogen hormones in women, cause the development of breast. But when there is an imbalance between the testosterone and the estrogen during puberty, and there is a delay in production of testosterone by the testes, and there is a peripheral conversion of estrogen from fat in men or in boys, gynecomastia can develop by proliferation of this breast bud. So it's fundamentally the issue that has arises sometime during puberty that causes 95% of the gynecomastia cases that we see. The remaining 5% of gynecomastia cases which develop later on in life are invariably due to some medications or some underlying medical issues that can cause gynecomastia. So we have to be very careful in such individuals, because gynecomastia could be a cause of something which is more serious underlying, but then that's only in 5% of individuals, and 95% of them is fundamentally a hormonal imbalance that has occurred sometime during puberty. Now coming to some important points regarding gynecomastia. So a lot of people come to me saying that they want a Scarless gynecomastia surgery. So what is this Scarless gynecomastia surgery? Now, prior to it becoming very popularly done by the plastic surgeons, gynecomastia surgery was done by general surgeons. And these general surgeons would give big cuts from here all the way here, and they would lift the skin and remove the gland and fat and then give you a stitch that is so big. Now, after plastic surgeons became very aggressive in managing gynecomastia, we do it with only tiny holes. So basically, if you see what it encompasses, it's basically removal of the fat and the gland. So just below the nipple and areola, there is always a gland that is present. That is the breast bud which I was talking about. Surrounding that, there is a lot of fat. So we have to tackle both. So generally, it is a combination of fat removal by liposuction and gland excision through a circumareolar incision on the nipple. Now, there are different ways in which we can do it. And basically, a Scarless technique is where there is only one opening on the nipple areola. The nipple areola is darker skin and it has multiple lines on it. So these incisions that we give either at the rim or just a few inside are invariably they get intermingled with the surrounding lines, and so they are not at all visible. So this is basically what is the Scarless technique. That is, we don't use any other hole except one on the nipple areola, and that leaves the least amount of scars. In conventional gynecomastia surgery, we give a small cut either in the side here or in the axilla here, through which we do the liposuction. So instead of giving these two additional scars here, we give only one scar on the nipple areola, and we do a circumferential liposuction all around the chest and remove the gland through the same incision. So this is what is called Scarless gynecomastia technique, and it takes a little longer than the conventional technique.